start off today, we're actually going to talk about you as mothers and your oral health and the importance between oral health and pregnancy. So to start off, I'd like to let you know that throughout a person's life, men and women have different levels of hormones. So one of those times is when you hit puberty. The level of sex hormones rises significantly. And then another one is that during pregnancy, the levels of your hormones are significantly higher than other times in your life. So hormones are just kind of, in case you don't know, they're like chemical messengers. So imagine like train cars going to a destination. So the hormones are traveling to different important organs in your body and stimulate responses. Two hormones that are at the highest levels are estrogen and progesterone. So in the second trimester of pregnancy, they are at the highest level. And in the 8th month of pregnancy, the most severe gum inflammation is present because of these high hormone levels. So about half of you will suffer from what is known as pregnancy gingivitis. So again, we're talking about your gums around your teeth. And it's the most dramatic in the 8th month, and it's unrelated to plaque or bacteria in your teeth. But some characteristics of this do include bacteria, red, bluish gums, swelling, bleeding, soreness. So here's kind of a picture of some healthy gums and what they look like if you have some inflamed gum tissue. And something else that can happen during pregnancy is called a pregnancy tumor. So basically what that is, it's sort of like bulbous tissue that occurs around some of your gingiva. I don't know if any of you noticed that. But this is reversible after the baby is born, so it does go away. So there's also a specific bacteria that is associated with pregnancy that's at high levels in your mouth when you're pregnant, and that's called P. intermedia. So that's really important to know. And this is what causes a lot of these problems, the gum inflammation. And this can eventually lead into something called perio disease. What that is a continuation of the gingivitis that has not been treated and oral care is not happening. So this can kind of go further and cause bone loss, okay, which is irreversible.
In your teeth?
Yes. Yeah, the bone actually is gone in your teeth. So I just want to talk about a couple of things. So it is recommended that pregnant, you ladies, women with inflammation, inflamed gums, or even bone loss have treatment as soon as the 2nd trimester, not during the 1st trimester. Any infection can influence the fetus, so that's why we want to wait until the 2nd trimester. Some other things recommend that you ladies brush your teeth twice a day for 2 minutes at a time. So Jen here is going to talk to you about a method of toothbrushing called the fast method. So you want to make sure you're doing that properly.
You guys all know how to brush your teeth, right?
We think.
But some people think that the harder that they brush their teeth, the better that they're going to do, the more bacteria they're going to get off. That's not true. You don't want to brush really hard because that's going to wear away your gingiva. It can cause recession, show that root underneath. So what we want to do is have first of all, you want a light bristled toothbrush, a soft one. And you want to use a light to moderate pressure on your teeth. And you want to make sure that the toothbrush is angled at a 45-degree angle up towards your gingiva and getting underneath that gingiva tissue, because that's where most of the bacteria is, and you want to get that off of there. So you just want to,
I'm going to grab your Typodons.
Yeah, you guys, that's what it's there for. Just practice. You want
Let
to
me
go
see
back
what
and forth on the inside and the
now?
outside of the tooth,
Oh, Mama, I can use
and then down on top of the occlusal surface. You guys all know how to floss, right? I would hope so.
Well, I just want to mention something quick before Jen talks about flossing. I just want to mention one more thing. So when you're brushing your teeth, though, you want to make sure you're going over each area. You're overlapping, so you're not missing any part of the tooth, because then that bacteria can't get out of there. So you want to make sure you're doing that. and you're not using too much pressure.
And with 2 minutes, you know, you have 4 quadrants of your mouth. It's easy to use 30 seconds on the upper left, and then the upper right another 30 seconds, and then, you know, all the way around the mouth. And you want to make sure you brush your tongue as well when you're done brushing your teeth, because your tongue holds a lot of bacteria that you want to get out of there. So with flossing, I'm sure you all know how to floss, but just to make sure, you know, you want to put the floss between each tooth. Oh, thank you. And you want to make sure you go at like a curved angle, so you get underneath of that, you get under that gingiva tissue. You kind of want to go at a back and forth angle as well to move that bacteria and get that off of there. And we always advise people to use a really long piece of floss, because you don't want to use the same area of floss throughout your entire mouth. You want to move it on your finger, and every time you do a tooth, you want to switch it and, you know, just keep going down the line of the floss. So that's always.
Because if you use the same chunk throughout your whole mouth, you're spreading the bacteria from one tooth, say, between the next and the next and the next. All right, so now that we talked about how to clean your mouth, I'm going to talk about how to clean your baby's mouth. Now, before your child's first tooth erupts, do you think you need to clean their mouth? Yeah. Correct. Nailed it. So you want to clean their mouth about 1 to 2 times a day with a warm, damp towel or a gauze, something like this. It's a little gauze square, and you can get it wet. And then what you'll want to do is you'll lift their lip, and you'll just kind of wipe, pretend that there are no teeth. You'll just kind of wipe like that on their gums, just to keep them clean. Typically, you'd want to do this after a bottle or breastfeeding, or after they wake up, because I know sometimes they'll fall asleep after you feed them. Another option would be to do it while diaper changing. Remember, be sure to maintain sanitation, obviously, but when you're changing their diaper, they're already on their back. This is a positive experience between you and your baby. You're smiling, it's a bonding time. This would be a nice time to introduce them to something new, like your finger in their mouth. So that would be a good time to start doing that too. Cleaning their mouth regularly will inhibit bad bacteria from finding a home in your child's mouth. Additionally, it will also help you to know when their teeth are beginning to erupt, because you'll be used to feeling in their gums, so you'll feel maybe there's like a little bump over there, so you'll know they might be a little fussy or something, they're teething, and you'll just be on track with that. And now Paige is going to talk about teething.
So do any of you know when the first teeth start coming in?
By 4 months.
Actually, close, in between there, 6 months. So 6 months, and it varies from kid to kid. So I think girls get them before boys, so just keep that in mind too. But it varies. So while it varies from child to child, you will start seeing around 6 months. It may take longer, and you may start to see like the nub of the tooth coming in, so just the top of the tooth, and it may stay that small for a little bit. So don't worry, they're not going to have like a tiny little tooth, hopefully. It's just making its way up, and then it will get to the level of all the other teeth eventually. So the first teeth that are up are the bottom front teeth, and we're going to hand this chart out to you. And so these would be the first teeth that come in, and then the top front teeth, and then the teeth on the side, and they just kind of keep erupting like that in pairs on the side of the mouth. This is usually complete by 2.5 to 3 years old. Again, that varies, so don't get concerned if it's taking longer. The child will have the baby teeth till approximately 6 to 7 years old, and then they'll start shedding them for permanent teeth. When teething, babies can become very fussy, which a lot of you probably already know. This is just because their gums are sore, the teeth are popping through that tissue. They might say they don't want food, they might push it away, they might bite on their fingers more to relieve the pressure that they're getting. So that's all normal. You may also notice a rash on their chin, and that could be from drooling more because they're teething. So if you do notice a rash, just get cream from your doctor. But some other ways to relieve pain are using, again, a clean finger and just rub the gums in the area where you think the tooth is coming in for like 2 minutes. And that just helps relieve the pain, and that's kind of what they're doing when they're biting on their fingers. You can also use things like teething rings, anything safe, you know, for the baby. And they can chew on that all they want, as long as it's a safe object for them to chew on. You can put it in the refrigerator to cool it off. Be careful about the freezer, because of course, when it's in the freezer, you don't want to give it to them right away, because their lips can stick to that, and that can cause damage. If you think your baby's having worse than normal teething issues, definitely try to go see a doctor or any other resources that your teacher can give you, and they might prescribe a pain medication safe for the baby to use. Don't just use whatever you would use. You gotta make sure it's safe for the baby. Some people go for the teething gels, and the FDA is actually warning against that right now because the teething gels can numb the baby's throat. So they could have problems swallowing, breathing. So just make sure it's something that the doctor has okayed. And that's it for me.
So now once their first tooth erupts, you want to call your dentist and see if you can schedule your child's first cleaning. This should take place within 6 months of their first tooth erupting or before their first birthday, whichever comes first. And you want to then continue with regular checkups every 6 months. Now, your regular dentist may not accept patients under 3 years old. This is only a personal preference that some dental offices have, but there are many offices that will see your child under 3 years old. And this is actually what the American Dental Association recommends. But don't forget to continue to clean their mouth with a warm, damp towel or gauze. Now, once your child begins a transition to table foods or finger foods, this is when you want to introduce your child to a toothbrush. Extra soft bristles, and be gentle. This should be a fun experience, not traumatic. Start very slowly and gradually increase the brush time to 2 minutes. Even if the first week or 2 weeks it's just a couple seconds, introducing it slowly will help. Remember, if you already have been cleaning their mouth with the gauze, then this shouldn't be so new to your child and will make the transition to toothbrushing smooth.